Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
All right. Brin and Sabrina, welcome to the podcast.
Thank you so much for having us. This is awesome.
Oh my God, it is so awesome. And it's about time. It's been a long time in the making of scheduling. So I just wanted to start by saying thank you for joining us. And then maybe ask you to briefly introduce yourselves and tell our listeners a little bit about who you are and what we're going to talk about today.
Beautiful.
So my name is Dr. Sabrina Ma. I'm a dentist in Victoria, and my husband and I, we own a practice together in Langford.
Yeah.
Pathology and dental.
Yes. I'm Dr. Brin MacMillan, just like Sabrina said. We met in dental school, which is a cute little thing. Moved from Windsor, Ontario to Victoria, British Columbia, and I was born and raised in Victoria, BC. This was a great spot for us to set up.
Oh yeah, that's funny. I met my husband in residency, who's also a physician, and he's the one who's from here, and I'm from the East Coast. So very similar.
Funny how that works out.
Okay, so we are talking about dental care in pregnancy, and we have had so many questions.
Yeah, this is great.
Yeah. So I thought we could just start by you guys diving in. And do you mind sharing a little bit about what changes that you might see from a dentist's perspective in pregnant people?
So pregnancy gingivitis is a very common thing that happens. So basically, it's the peak of your pregnancy hormones, so estrogen, progesterone. Pregnancy gingivitis typically peaks at month 8. So that's when you can start to develop very swollen gums, very sensitive. Even when you just touch it, brush it, floss it, you're just exhibiting a lot of bleeding. So that's probably the number one thing.
Yeah. With the progesterone and estrogen, you get the increased vascularity
Yes.
in gums. And that actually also correlates with your periodontal ligaments. So we got millions of muscle ligaments that hold your teeth to the bone. And if they get inflamed, then your teeth tend to feel pretty loose. It also feels a little unstable. And with that being said, essentially.
So yes, that it can cause a little bit of like tooth mobility. So we had a couple questions about that. People's teeth feeling a little bit loose in their mouth. So that is a thing.
I had no idea that was a thing.
Yeah.
Especially if you're a clencher and grinder as well, you're putting more forces on your teeth.
Okay.
Or if you have what we call diastemas, like little space in between your teeth, so your teeth aren't really locked into place.
Yeah, there's no stability on either side of your teeth. So your teeth just feel loose. With that being said, when people are clenching and grinding, I'm sure a lot of people have heard of night guards. The downfall with a night guard is it's a big chunk of something in your mouth. And unfortunately, when you're pregnant, especially in the first trimester, I'm sure with morning sickness, it's not the greatest thing to have.
Your gag reflex just gets squeezed.
Yeah. Yeah. So it's like a mixed.
Yeah, it's a toughy one. Yeah. But at the end of the day, I guess take a big deep breath and just realize it's going to happen. The big thing to be on top of is to be on top of your oral hygiene, obviously at home. The big myth is a lot of the times we think, hey, if you're pregnant, do you go to the dental office?
Yes.
I definitely say you should 100%.
Well, your oral health is a big component of your overall health, and you want to be the healthiest version of yourself for your baby. So there's a lot of consequences if you do have poor oral health, and it can be passed on to your baby.
Or it could actually lead to you having some issues
During pregnancy
or after pregnancy.
Yeah.
So the big thing is be on top of your oral health. This actually stems a little bit before you're pregnant. If you know you're trying, it's probably a really good idea to be on top of your overall health. And that includes going to see your dentist, getting regular checkups. The moment that you are pregnant, you really want to stay away from x-rays as best you can.
Okay, that was a question we had. Yeah.
Yeah, that was a question we had. And with that being said, it's nice if you are trying and you aren't pregnant yet to come in for a routine checkup and get your x-rays so that you know in advance and be proactive rather than reactive.
Because most cavities that we see are typically, they form in between, sorry, they form in between your teeth. I'd say most people are really good at brushing, but most people aren't very good at flossing. So that's where a lot of interproximal in between your teeth, those cavities develop. And we diagnose those at an early stage with x-rays.
Oh, okay. I was going to ask. So with the x-rays, you're looking for cavities as well as.
Infections, abscesses.
Yeah.
Um,
Bone
most,
loss.
most of the time you'd hope that someone would come in because when you have an infection or an abscess, you're in pain. You'd like to react to that.
But sometimes you're going to have an infection and you're not in pain. So it's still good to have your checkups with your x-rays beforehand.
Okay. And my understanding is, though, and this is a question we often get, is but I had a x-ray and I didn't know I was pregnant. For those early pregnant people, we put lead on folks, right?
Yeah,
Absolutely. Absolutely. Yeah. So it is a college guideline by our college that you must have lead aprons as well as a thyroid collar. The thyroid collar is actually the key component. Obviously, if you're unknown, it's usually the first trimester. And unfortunately, that is when the major development of the baby is happening. And big component is thyroid hormones are huge when it comes to brain and nervous system development. And so you really need that thyroid collar to protect your thyroid.
So there's a lot of lead aprons that have a built-in thyroid collar, but sometimes they can be like just a lead apron that they throw on and then they slap on the thyroid collar.
Yeah.
So most of the time that is used. So take all those precautions anyways. So it should technically be fine.
Yeah.
Another thing is that for a new patient exam, we typically take some intraoral x-rays where we'll use thyroid collar and
Lead apron.
the normal lead apron, but we usually take a panoramic x-ray as well. So that one has a pan-cape lead apron. So it doesn't really have the thyroid collar aspect, but that's because we need to see those structures down there as well.
Oh,
So
right.
it's blocking part of the image. But we don't take those x-rays very often. It's usually every 5 years. Patients can decline those. Those are totally fine.
Yeah. If you're thinking you might be expecting at one point, maybe just decline that panoramic x-ray.
Yeah. Okay. Now, I don't know if you know this answer, but people are just always concerned with x-rays in general. And so I tell folks like a chest x-ray, for example, is similar radiation flying from like here to Calgary, which is like a whack flight. So like, don't worry. I had a chest x-ray in pregnancy. I had a lead apron on. He's sitting on the couch playing Nintendo Switch because he's sick. Very intelligent.
Yeah.
Do you know the similar sort of like the radiation that
It is. We actually do. So for the panoramic one, it's very similar to the chest x-ray that you were talking about. For the intraoral images, it is extremely less than. So it's not something to be worried about. Now,
It's so localized.
so when I said x-rays, we try to stay away from, that is a key component. But at the end of the day, if you have an emergency and emergencies can arise for whatever reason, an x-ray is something that you should do.
Yeah.
In order to diagnose a problem.
Yeah.
And figure out how we can solve it.
Yeah. And
Sorry.
no, I was going to say it's so important to understand like the context, right? Like it's not like you're getting like a full body dose of radiation.
Yeah. And it's when you are protected with lead apron and thyroid collar, it's at the head and neck region. It's very far away.
Yes.
So not something to be too panicked about.
Yes.
So did you ever hear about that study? I think it was in California or something about the amount of radiation that you can get from eating a banana. Did you ever? This is a thing. Yes. So anyways, I just had this little chart and I don't want to freak people out about eating bananas because obviously there's a lot of good things about eating bananas. But for instance, I think a chest x-ray is about like 50 microsievert, something around here. And then a single dental x-ray is 0.2.
Oh my gosh.
So
Yes.
it's so minimal in your field. It's not like nothing.
Yeah. Yeah.
But then also eating a single banana is 0.1. Well, you can get, so there's this huge chart. If you look at the study, if you actually want to, you like comparisons of like taking a flight from point A to B is the equivalent of eating like a truckload of bananas or something.
Oh my gosh. The things that people in science do. That's it. Okay. So I'm going to summarize what we've talked about so far.
Yep.
So really important to try and get dental care pre-pregnancy, pre-conception. So just routine care, brush your teeth, floss your teeth, visit your dentist. changes that we see in pregnancy are increases in estrogen and progesterone, and they cause that inflammation in the gums, as well as some of that. And is that from the increased vascularity, like the
That's
big,
what yeah,
Exactly.
exactly.
and then
Yeah.
it's that vascularity and inflammation that also causes swelling in the ligaments, which makes your teeth feel loose, which is bananas to me and
Yeah.
very
Yeah.
scary. That did not happen to me in my pregnancy.
Yeah. And so the big important to add on that is the periodontal ligaments or the muscle ligaments that hold your teeth to the bone that get inflamed and cause them to be loose. They're actually a protective barrier for your roots that are under the gums. When you hear about people saying, oh, my gums have receded or they've dropped, those roots are exposed and they create a lot more sensitivity to hot and cold. So when you get inflamed muscle ligaments like that, it actually creates a bigger space for water, cold water or ice cream to shoot down your teeth and cause cold sensitivity.
I hate that.
So it's unfortunately, it's just par for the course.
Yeah.
Yeah.
Okay.
Return back to normal.
Yes. With that increased vascularity, the big thing is anything that's not a lot of blood flow in an area is unfortunately ready to bleed.
Yeah.
So stay away from hard bristle toothbrushes.
Okay.
We've learned that out of all electric toothbrushes, not to say you should switch your electric toothbrush because they cost money, but if you have a Sonicare, it is usually the softest,
The gentlest, yeah.
the gentlest, per se, if that's a word. And those are kind of the things that we recommend.
Okay. Okay. Because that was one of the questions. So now we understand why it happens. And then somebody was wondering about how to reduce the gum bleeding during pregnancy. So soft toothbrush would be
Soft toothbrush and honestly keep up with regular cleanings. And that was also the other thing is throughout your whole pregnancy, it's okay to have cleanings.
Yeah.
Yes, that was the question. And fluoride.
And fluoride too. Yeah. The fluoride, obviously, it's like anything. If you ingest too much of something, it's not good. So to a toxic level. So you don't want to be swallowing fluoride. Now, the big thing is too, is in the first trimester, when you do have some morning sickness, fluoride is not a very fun thing. It makes you a little nauseous. I don't know if you've ever got nauseous off it before, but I have. We do have it in two different forms. One is to actually have a rinse where you swish around. Downfall with the rinse is you do end up swallowing a bit of it, even if you don't think you do.
Yeah.
It's not in a toxic level, so nothing to panic about at all. Okay. But it is also something that could stimulate to maybe feel a little sick.
Yeah.
Okay.
So what we do recommend is using more of the varnish. We use varnishes on kids
Okay.
because we feel swallowing it. So varnish is where you actually just paint it on the teeth.
Oh, yes. I've seen
It feels gross and girly, but you know, it's good for your teeth. Yeah.
Okay. Okay. So fluoride is safe maybe in the first trimester, or if you're having significant nausea throughout, then just ask for the varnish.
Varnish.
Or avoid on the
Yeah.
two. Yeah.
Okay. No, that's great. And it's good. It's good to know. I know fluoride there's a lot of controversy, a lot of things.
Yes.
I know that I have great teeth because I had
Yeah.
fluoride in my water growing
Yeah.
up.
Yeah. Where were you born and raised again?
Prince Edward Island, Charlottetown.
Oh, yeah. Oh, nice. Okay. Yeah.
Cavities. How do we manage cavities in pregnancy?
That's a tough question. Realistically speaking, if you keep up your oral hygiene, cavities usually are not lower. They should be the same as if you were not pregnant.
Yep.
The only thing that we can state out there is, unfortunately, if you're not bringing enough calcium, because your teeth are mineralized, they're harder than bone. The upper enamel it is. That is, if you're not bringing enough calcium, unfortunately, the baby or the fetus is actually going to take it from you, which can prevent you from having enough minerals in your saliva, which then could correlate to getting more cavities per se. It's not very common, but
It's like a theoretical possibility. Very
yeah. Yeah. So I wouldn't want to say that you're more prone to cavities. You're definitely more prone to gingivitis or periodontal disease. Gingivitis is just a fancy word for saying inflammation of the gum. Periodontitis, inflammation of the bone.
And then with morning sickness, you're dropping the pH level in your mouth. And that's typically the environment of how cavities are formed in general. So basically, just quickly, how cavity is formed. Basically, you have something to eat. The leftover food in your mouth is eaten by the bacteria in your mouth, and the waste product of the bacteria is acidic. So that's what's eaten into your teeth. So
Okay.
if you have a very acidic environment in your mouth, you're very prone to cavity. So if you have morning sickness, so if you're trying to give advice to someone who has morning sickness, after they vomit, you want to rinse with like a little solution with a cup of water and baking soda to help neutralize the acidity.
Yeah, that's so genius.
Yeah.
Mhm.
And then so you can do that and then wait at least 30 minutes before you brush because your teeth are in that softer, low pH state. So if you brush right away, that mechanical disruption will actually strip layers of your teeth away. So
Oh,
you wait 30 minutes for it to kind of
Yeah.
neutralize the pH levels,
Yeah.
and then you can brush.
So if you're not around baking soda, just drink a lot of water.
Yeah, you don't always have that solution ready with you, but
Yeah. It's good to know, actually, to not brush your teeth right away, especially even as a mom of kids who sometimes throw up.
Yeah.
so even yeah, that does happen. But even not even relating to morning sickness. So even
Yeah.
after eating, it's not advised to brush right away. You still want to wait at least 30 minutes.
To let your, like, that environment go back.
Yeah.
Yeah. But I'm learning so much.
Hey.
And so if unfortunately someone does get a cavity or they get a cavity diagnosed in pregnancy, I would presume that you would recommend treating it the same way you would if the person was non-pregnant, because pregnant people deserve.
Yes. Absolutely. Yeah, I think it's very dependent on the severity though, because if it's in the first trimester and it's not something that's impeding their life and it's not going to turn into an infection,
Yeah.
then you want to postpone it. If you can postpone until after the birth, great. There are certain times where you can't. And second trimester is definitely the most important time, or the easiest time and the best time to be
Yeah.
treated.
Yeah.
Yeah. And then
You can treat in third trimester. It's just a little bit more uncomfortable.
and there's a small chance of inducing labor.
Oh,
Small.
with the treatment?
Yeah, with treatment if you're very close.
Oh, and do you know the sort of
I don't know that
It's
at
like
all.
stress-wise or
Stress.
like
Okay.
their local anesthetic. There's some of it does have epinephrine in it.
I don't think that's going to induce it though. I think
But
it's more the stress related.
Yeah.
Yeah.
Unfortunately, yeah, the dental office is not everyone's favorite place to be, which we all know.
I love going. I love how my teeth feel cleaning, but that's just, yeah.
Yeah. I would say a good percentage love coming, and then there's the percentage that don't, and we get that. And
Yeah.
So, but with that being said, going into that, I guess, per se, is we do try to stay away from certain drugs. And there are some drugs that are used commonly in dentistry for sedating or helping you feel comfortable.
Antibiotic.
Yeah. And any type of benzodiazepine, I would say you try to stay away from. I know that it's safe in theory from your point of view. I bet at normal, we do a loading dose, but yeah, in theory, you want to stay away from it.
Yeah, that's fair. And, yeah, they're safe in moderation, but if you can avoid it. So my understanding is your recommendation is if you have a cavity and it's not significantly impacting your day-to-day, you can
Yeah.
postpone treatment into the second trimester or even further, beyond into postpartum if it's a small, minor cavity. But if it's causing discomfort or you've got an infection, it's important and appropriate to treat it.
Absolutely. And at that point, it is appropriate to take an X-ray and go from there.
Yeah.
And you have very safe local anesthetics. In any dental office, for the most part, they should have multiple options of local anesthetics. There are certain ones that you want to stay away from. Don't know if names matter, but Articaine is one of them. Lidocaine is a most common local anesthetic.
I don't even know the first one that you just said. Articaine?
Yeah, Articaine, it's a higher percentage and it's just used more for local infiltration. But yeah, so lidocaine is super important, very safe. Not in
Across the board.
If you are super concerned at all, in theory, the half-life of lidocaine is 2 hours. So sometimes if I do have a very concerned person, I do say, hey, you know what? If you really want to, for breastfeeding wise, that is, after
Yeah.
pregnancy, if you're concerned, you could potentially pump and dump for 2 to 6 hours after procedure.
Yeah.
On the safe side, but it's
So minimal.
so minimal. And they say that after 1 week of the baby being born, it should be fine.
Oh, yeah.
Yeah, it's
Well,
weird.
here's a news flash. We use local anesthetic when we're repairing the perineum while
There you
the,
go.
while the mom is actively breastfeeding.
Yeah.
Yes.
Okay.
So
Right.
there's
Oh,
a news flash all the time. And it's funny because in our world of dentistry, even nitrous oxide, laughing gas,
yeah.
is air quote unsafe. And you use during the labor. So no, I mean, in theory, you can avoid it while you're pregnant, but afterwards with breastfeeding, nitrous oxide is great too. And that's a really good sedative. It's right out of your system right away. It's usually the one that we recommend the most.
It's so interesting, hey, how there's this like risk perception because it's here and not. Yeah.
I know. Bizarre.
Yeah, because that was one of our questions about local anesthetic while breastfeeding. And
Yeah. No issues really overall. And just if you want to be safe, you just pump and dump as long as you're able to breast or a bottle feed.
Yeah, no, exactly. And one question didn't come from our audience, but our follower.
You forward.
We alluded to at the beginning, and I thought maybe we could just talk a bit more about how dental care and dental hygiene relates to general health as well as pregnancy health.
Yeah.
And yeah, I wonder if you could just talk a bit more about that so people can understand why.
So there's a lot of studies that can, obviously there's certain things out there that can prove something exactly. but then there's other studies that show a correlation.
Yeah.
And when it comes to periodontal disease, which classified as gingivitis, and periodontitis, which is bone loss, it shows that actually there is a potential for low birth weight in your child. Also, that there's also premature births,
Hmm.
and even for the mother, preeclampsia as well. Yeah, which is interesting. So it is actually really important around this. With the premature birth stuff too, there's the big one is hypoplastic enamel. So the outer shell of your tooth, which is the hard part, becomes really soft in the child when they have their baby teeth. Baby teeth are super important. I know we think, oh, okay, we're getting our adult teeth and whatever, their baby teeth, but they're actually really important for nutrition for your baby. They're also important too to hold the space for when your adult teeth come through. And you always hear people going, oh gosh, I don't want to have to pay for braces, this, that. This is the most important way is just be proactive, and that way you won't hopefully need braces.
So fascinating. And as you're saying all this, I'm thinking like if you've got inflammation and infection, that's causing a lot of like immune reactions and cytokines. And that's probably like they're floating around in your blood. They're potentially crossing into the placenta. So I can see now that we're diving deeper, some of what we would say like the pathophysiology behind it, which totally makes sense.
Yeah.
And you know, it's really interesting. I always have to pull in a personal anecdote, but one of my kids, one of his baby teeth was very discolored.
Okay.
And our dentist was thinking like you probably had some kind of something probably happened at some stage in your pregnancy.
Yeah. There was something because we were reading into that a little bit. There's tooth discoloration due to increased bilirubin. I don't
Interesting.
know any of that, but that's all we read, and I didn't want to dive further into it.
Right? Yeah. It could have been like some kind of minute because I think it had something to do with the enamel on that too.
Absolutely. Yeah. There's a lot of things actually.
Was it baby tooth or permanent tooth?
Baby tooth.
Yeah, so definitely. Yeah. The other thing too is because with the preterm births as well, when they're in NICU and they're on the side of their face, unfortunately, they're lied on their they're down.
Yeah.
It actually causes them to get what you call a dolichofacial pattern, which is an elongated face, which then can correlate with a narrow palate.
Oh.
Then you're kind of diving into, you need to interrupt all this at an early age before usually 6 years of age, before
Like expanders.
or headgear and all that. So it does make a difference.
Yeah. Okay.
Yeah. I'd say that's always the case, but not to scare you. Yeah. Right.
Well, it's just important to be informed. That's the whole purpose of like why we are doing this work is to inform people and educate people so that they can advocate for themselves and their child.
Yes. And with that being said too, make sure to still take your vitamins and such and supplements like folic acid, because there's a big correlation between folic acid and cleft palates.
Yes. Yeah. Yeah. It's so interesting. Okay. So I've learned so much. So basically, take care of your teeth before and during pregnancy. Go for routine care, routine visits, x-rays. If you can avoid them, especially in the first trimester, that's great. But if you need an x-ray because of concern around infection or inflammation, it's totally safe and appropriate. If you need any treatments, again, if they can be avoided, you can wait. But if you need a treatment, it's important and safe. And then we just talked a little bit about the changes and what the consequences of infection or chronic inflammation can be in terms of the pregnancy. That is crazy. I didn't know any of this stuff.
Yeah, it's really cool. Yeah.
So anything else that we didn't talk about that you guys think we should cover?
I made a whole bunch of notes here. Let me just
Some random ones too is these are really out there per se, but if you are going to come in for treatment, second trimester, like we mentioned, is usually best. Big one too is ask to or bring your own, but hopefully a dental office has it, but try to ask for a pillow and try to get a pillow on your right side.
Or even like a rolled up towel.
Yeah.
That was like the big one because supine hypertensive syndrome, right? Which is when you get too much pressure from the fetus on your inferior vena cava.
Yeah.
It can relate to not syncope per se, but making you feel sweaty. Not feel good.
Yeah.
Yeah.
And maybe another recommendation for people who are experiencing pregnancy gingivitis or want to prevent it from happening, different types of toothpaste that can maybe aggravate.
Yes.
So if you're using a whitening toothpaste, I'd probably avoid it because usually whitening toothpaste don't actually have a whitening agent in it. It's just more abrasive.
Oh, interesting.
Like kind of scratching off a layer of your tooth. So eventually your teeth probably won't look white anymore because you're stripping your enamel. So in general, we don't really even suggest people to use whitening toothpaste. there's other ways to whiten your teeth. But also, I would suggest using a toothpaste that doesn't have SLS in it because that is a bit of an irritant.
Okay.
So one toothpaste that we know for sure doesn't have it is Sensodyne Pronamel. That doesn't have SLS in it. There are a lot of patients or people that are sensitive to that too. So
Side note, we have no stake in Sensodyne.
no,
Right?
not a lot with Sensodyne.
Okay, you go. Actually, and that brings up another question. I don't know if we had it in that little question box I put up, but I've had people ask about, are teeth whitening treatments safe in pregnancy?
So we wouldn't advise to get whitening at the
Yeah.
time. And then
Yeah, from what we gathered, it's really not the safest thing to be doing. So I would avoid that. Cosmetic work too, which is completely
it's so elective.
elective,
Yeah.
I would avoid at all costs if I was you.
With that being said, if there's patients who have like demineralized teeth, hypocalcified, and they have little like chalky blotches on their teeth, then that can actually be remineralized in office or even at home just by switching their toothpaste to something called MI paste. I don't know if you've heard of MI paste before,
Yeah.
but it's basically a mineral toothpaste. So you can get it with fluoride or without fluoride. So if you get the patients that don't like fluoride or they don't believe it or they try to avoid it, that's a really good
Alternative.
and you can use it pregnant, in kids. They can accidentally swallow it. It's totally safe.
MI
MI
paste, yeah.
paste. So a lot of dentists might smell it.
Yeah.
It's
We get it ordered in and then we sell it for no extra charge. We just sell it for
yeah,
the
I think
cost.
Amazon sells it, but I think they upcharge by $15 or something.
Yeah.
They sell it for $35 or whatever.
Oh,
Anyway, that's the good stuff.
yeah.
Yeah.
And on the same line, I'm going to guess I know the answer, but I see a lot of, this is just me asking out of curiosity. I see a lot of people Invisalign lately.
Yeah.
Would you want that during pregnancy with your teeth being loose? What would you do there?
That's a good question. We are both general dentists. We don't really do a lot of orthodontics per se.
Yeah.
From the theoretical side of it, it doesn't make sense.
Yeah,
You
that's
don't-
what I was thinking. If your teeth are
Yeah.
loose.
So if you're in the middle of it and you're like, oh my gosh, I just got pregnant. Should I just continue with this? I'd probably just stick with the tray that you have right now and try not to move your teeth any further
Yeah.
because moving your teeth is an inflammatory process.
Yeah, that's a good point. It's also interesting, you guys.
Yeah. The other big one too, also out there is, unfortunately, with this whole inflammation of the gums, there is a chance that if you irritate them too much, you can get something called a pyogenic granuloma.
Oh, yeah. And those are common in pregnancy.
They are
Common,
really
and they're
common.
unfortunately very common, and they look, without better words, they look scary.
Yeah.
Yeah.
The nickname for it is pregnancy tumor, which sounds
Yeah.
awful.
Yeah.
It's like red vascular.
Massive
Yeah.
kind of thing.
Ah.
It's usually on your gums, purely on your gums. Sometimes it can get on the palate. It looks awful. If you see something like this, go see your dentist and hopefully get reassured. It's not something to be worried about. There are studies out there showing that you can have it excised off or removed, but it's not actually a good thing to do while you're pregnant. And they usually resolve on their own most of the time. But if they don't, after your pregnancy, you can get it removed. With that being said, because you're cutting it out, the irritation of cutting it out is actually going to cause it to reoccur.
Yeah.
Yeah.
Oh, yeah. The big thing though out of this is if you feel like there's this big bump on your gums, go to your dentist and be reassured that it's not a big deal.
Yeah.
All these fun things that can happen, unfortunately.
It's so interesting, hey? And it just shows you like how pregnancy is like a whole lot. Like it affects everything in your
Everything.
life. And also how
Yeah.
your oral hygiene can affect your entire health because of like all your blood flows through your mouth.
Yes.
Yeah.
It's crazy. Yeah. Even like without being pregnant, periodontitis and gingivitis and correlation with diabetes and
Heart disease.
heart disease. There's a lot. So
Yeah. Dementia. Yeah.
yeah.
Lot the
Cool. Interesting. Amazing. I'm super stoked that we finally got together and had this conversation.
Yeah. That was awesome.
Yeah. We'll put together some show notes for folks. And then maybe I will get you to email me your clinic address or name or just whatever and the MI paste. Because
Yeah.
we're at BC. We got a lot of people who don't like fluoride.
Yeah.
I know,
Yeah.
right?
Yeah.
Yeah.
So having safe alternatives, if that's their choice, it's great. Amazing. Thanks so much for your time today, you guys.
No worries. Yeah. That was awesome.
Yeah, it was really fun. Amazing. Thanks so much, you both.
Yeah. It was nice to meet you.
It's fun. Have a great day. You too.
Thank you. Goodbye.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.foundhealth. found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.